What I'm about to reveal could completely transform your understanding of aging and your body's hidden potential. Right now, as you watch this, your body might be silently deteriorating in ways that could devastate your brain function, heart health, sleep quality, and immune system, all because of one critical mistake most men make after 60. This isn't about vanity or desires. This is about survival, vitality, and preserving the man you've always been. I'm Dr. Marcus, a board-certified urologist and men's health expert with over 3 decades of experience treating thousands of senior men across the nation. What I've discovered in my practice will shock you, but more importantly, it could save your life and restore the energy, clarity, and confidence you thought were gone forever. Before we dive deeper, hit that subscribe button and ring the notification bell, because the information I share could be the difference between thriving in your golden years or slowly fading away. And please, comment "ready" if you're prepared to hear what most doctors won't tell you about your body's most overlooked health secret. The truth is, when men stop engaging in regular self-stimulation as they age, they unknowingly trigger a cascade of health problems that extend far beyond what you might imagine. This isn't locker room talk. This is clinical science that could revolutionize how you approach your health and longevity.
The hidden crisis. What happens when you stop? Prostate deterioration and urinary dysfunction. During my 30-plus years in urology, I've witnessed countless men suffer unnecessarily from what I call neglect-induced prostate complications. Just last month, a 72-year-old patient sat in my office, frustrated and exhausted. "Dr. Marcus," he said, "I'm up 5 times every night, and my stream is so weak I can barely function. Is this just what happens when you get old?" The answer is absolutely not, and here's why this matters to you. Your prostate isn't a passive organ sitting dormant in your body. It's a dynamic, living gland that requires regular stimulation to maintain optimal function. When you cease regular ejaculation, whether through partnered intimacy or self-stimulation, prostate fluid begins to stagnate. This stagnation creates the perfect environment for inflammation, swelling, and the kind of pressure that disrupts everything from urination to sexual function. The consequences manifest as weakened urine streams, incomplete bladder emptying, and that persistent feeling of fullness that never quite goes away. These aren't minor inconveniences, they're warning signals of a potentially serious condition. Research reveals that nearly 50% of men over 60 develop benign prostate hyperplasia, BPH, a condition directly linked to chronic prostate congestion. Left untreated, this can escalate to urinary retention, recurring bladder infections, and potentially the need for surgical intervention. Here's the breakthrough. Studies consistently demonstrate that men who ejaculate at least 21 times per month have significantly lower rates of prostate cancer compared to those who don't. Regular ejaculation facilitates prostate drainage, eliminates stagnant fluid, and reduces the risk of dangerous cellular accumulation. If you're finding value in this information, please give this video a thumbs up. It helps me reach more men who desperately need to hear this message.
2. Cognitive decline and mental fog. Recently, a highly intelligent 68-year-old former engineer came to my office with a complaint that's becoming increasingly common. "Dr. Marcus, I walk into rooms and forget why I'm there. I lose my train of thought mid-sentence. I used to be razor sharp. Is my mind just giving up?" What most people don't realize is that sexual activity, including masturbation, provides powerful protective benefits for brain function. During sexual arousal and climax, your brain releases a cocktail of neurochemicals, dopamine, serotonin, and oxytocin, that are crucial for memory formation, focus, and emotional regulation. These biochemicals don't just make you feel good temporarily, they actively promote the growth and maintenance of neural connections. They increase blood flow to the brain and reduce cortisol, a stress hormone that literally damages brain cells when present in excess levels. When you eliminate regular sexual activity from your life, these protective chemical surges become infrequent. Over time, this can dull your mental edge, making it harder to concentrate, process information, or maintain motivation. The decline is gradual and insidious. First, you forget names, then you lose track of dates, then you begin to question your own judgment entirely. There's also a hormonal component that's critically important. Testosterone, which is closely linked to memory, decision-making ability, and mental vigor, can decline more rapidly when sexual activity drops to near zero. Regular, healthy ejaculation helps maintain and regulate testosterone levels as you age. Some studies have even connected reduced sexual activity in older adults to early warning signs of dementia and cognitive impairment. I'm not suggesting that stopping masturbation causes Alzheimer's disease, but I am stating this clearly. When the brain is deprived of regular stimulation, hormonal support, and emotional release, it becomes more vulnerable and loses its natural resilience. 3. Depression and emotional numbness. One of the most heartbreaking consultations I've had was with a 74-year-old widower who looked me straight in the eye and said, "Dr. Marcus, I don't feel anything anymore. Not happiness, not sadness, just emptiness. Is this normal at my age?" That question haunts me because I hear variations of it constantly. The emotional flatness, disconnection, and gradual fading of feelings that many people accept as inevitable signs of aging often have a deeper, more treatable physiological cause: the absence of sexual stimulation and self-pleasure. Masturbation isn't just a physical act, it's an emotional release and your body's natural stress reduction mechanism. During climax, the brain releases powerful hormones like oxytocin and endorphins, natural mood stabilizers that combat anxiety, tension, and depression. When you remove this release from your life, you risk falling into emotional numbness that can evolve into clinical depression. This is particularly dangerous when combined with the stress, loneliness, or grief that often accompanies aging. If this information is resonating with you, please comment below and share this video with someone who might benefit from hearing this message. Your engagement helps me continue providing this vital health information. Depression in older adults doesn't always look like sadness. It frequently manifests as fatigue, irritability, social withdrawal, or simply a lack of interest in activities that once brought joy. I've seen remarkable transformations in patients who simply reconnected with physical self-intimacy after years of neglect. One gentleman told me, "After I started touching myself regularly for the first time in years, I felt alive again. It reminded me that I'm more than just a body that's shutting down, I'm still a complete human being." 4. Sleep disruption and insomnia. A few months ago, a 66-year-old patient came to me looking absolutely exhausted. "Dr. Marcus, I fall asleep fine, but I wake up at 2 a.m. like someone fired a cannon. Then I just lie there staring at the ceiling until morning." After ruling out common culprits like sleep apnea and medication side effects, I gently inquired about his intimate life. His response was telling: "That part of me is finished." But that finished part might have been the key to what his body was desperately craving: deep, restorative sleep. Sleep isn't simply about lying down and closing your eyes. It's a complex hormonal process, and most people forget about one of the most natural sleep inducers available to them: orgasm. During climax, your body releases a perfect chemical cocktail: endorphins, prolactin, and oxytocin that naturally transitions your nervous system from stress to rest. Simultaneously, cortisol, the hormone that promotes anxiety and alertness, drops dramatically. Your muscles relax, heart rate stabilizes, and breathing slow, creating the ideal state for deep sleep. Now imagine completely removing this process from your life for weeks, months, or even years. When older adults stop masturbating, they lose a natural tool their body once relied upon. What fills that gap? Usually restlessness, frustration, and hours of tossing and turning. The consequences of poor sleep extend far beyond tiredness. Chronic sleep deprivation weakens immunity, accelerates cognitive decline, increases heart disease risk, and makes individuals more susceptible to anxiety and depression. 5. Weakened pelvic floor and circulation problems. A few years ago, I treated a 70-year-old retired firefighter who had spent most of his life as a proud, physically strong man. He came to me complaining of mild urinary incontinence and difficulty standing for extended periods without experiencing hip and lower back discomfort. "It's strange, Dr. Marcus," he said. "I feel like my body's foundation is slowly crumbling." He wasn't just describing aging, he was describing the gradual, silent deterioration of his pelvic floor. The pelvic floor consists of muscles at the base of your core that support your bladder, bowel, and sexual organs. Most people don't think about these muscles until something goes wrong: erectile dysfunction, constipation, urinary leaks, or pain when walking or standing. Here's what's often overlooked. Regular sexual stimulation, including masturbation, is crucial for keeping those muscles engaged and active. During arousal and orgasm, the pelvic floor contracts rhythmically. This contraction isn't just incidental, it's purposeful exercise that maintains muscle tone, improves blood flow to the lower body, and keeps nerves and muscles in proper communication. When you stop regular masturbation, those muscles don't just go quiet, they begin to atrophy. Nerve responsiveness decreases, tissues lose elasticity, and blood flow diminishes. Eventually, you might experience symptoms you never anticipated: frequent urges to urinate, difficulty during movement, difficulty controlling gas, or even slight leakage after using the restroom. Conclusion and call to action. The 7 consequences we've discussed aren't isolated problems, they're interconnected elements of a comprehensive health crisis that affects millions of older men who've been led to believe that their sexual health no longer matters. But here's what I want you to understand. Reclaiming your sexual health isn't about returning to your youth or chasing fantasies. It's about honoring the life that remains within you, maintaining the biological processes that keep you healthy, and refusing to accept unnecessary decline as inevitable. If this message has opened your eyes to possibilities you hadn't considered, please hit that like button to help other men find this crucial information. Subscribe and ring the notification bell for more life-changing health insights. Comment below with your thoughts or questions. I read every single one. Share this video with someone who needs to hear this message. Your body is still capable of vitality, pleasure, and optimal function. The key is giving it the attention, stimulation, and care it deserves. Don't let shame, misconceptions, or outdated beliefs rob you of the health and happiness that can still be yours. Remember, taking care of your sexual health isn't a luxury. It's essential maintenance for your mind, body, and spirit. You're worth the effort, and your future self will thank you for taking action today. Comment "Ready" below if you're prepared to reclaim your health and vitality. Your journey to renewed wellness starts with a single decision. Make that decision today.